Hi, this is Peggy Earle. I'm the clinical specialist for ETS Wound Care, and today we're going to be watching a dressing change and some wound care on our model here. First of all, we're going to clean with saline, and I like to use this nice little foam sponge so that we can make sure that we get all the surface of the wound bed cleaned up. As you can see, this wound does have some tunneling here and some undermining on this side. Of course, if we were a doctor, we would probably be doing a nice sharp debridement on that area of undermining. I'm just going to blot out the excessive moisture there. And I'm going to be using a 2x2 MIRRAGEN packet for this wound. And you can see that it's nice and fluffy with lots of layers. We're going to see how far this 2x2 will take us today. I'm just going to remove some layers of product. I'm going to address this area of undermining right now. So with undermining, you can see I just rolled that product in a little wrap, and we're just going to press it back there toward the end of that tunneling without actually compressing the product itself. Same thing with the undermining. I'm going to just kind of push the product back into that area. So not to compact it. Remember that we are dealing with a product that's made of glass, and if we compact it, it will have some difficulty with dissolving in this moist environment. So with MIRRAGEN, it's only important to cover the surface and a surface layer. We do not have to pack or fill. We really just need to make contact with the wound surface itself. And so this 2x2 is going to be sufficient to make that work. So you can see we have some empty space there, or some dead space. With that dead space, we're just going to fill with some crumpled gauze. Any kind of sponges that you have will be sufficient to fill that space. Let's just leave it at that, and then we'll use that also as a topper. Want to make sure that we're securing the edges at least a centimeter or two out from the wound bed itself so that we have good adherence. I'd also suggest that you make your cover occlusive. Not only does it maintain your dressing better, but it's also going to give you some bit of moisture management, so you can make sure that you don't dehydrate the wound, especially if you're using gauze as a topper. We'll just do that center, making that an occlusive dressing. Of course, you could use a 4x4, 6x6 transparent film as well. Alrighty. And so that concludes the dressing of this wound. I would instruct you that this dressing may stay in place for up to 7 days, depending on your moisture. Also, if this were a true wound, I would want to place this patient on some pressure reducing surface, just like I would any other pressure ulcer. Thank you very much.